Go.
Hey guys, Dr. Ray Marque here. We're at Back Pain Relief Center, and we're here with the very beautiful Erica, and she is having a hard time today with her neck. So she woke up this morning with it?
Yes.
Okay, so try to look over your right shoulder. She can't look over her right shoulder, so that's a stiff neck, or sometimes they call it torticollis. Pretty painful?
Yes, it
Very
is.
painful. So look over the other side, because you can look over the other side pretty well. So when I touch her here, we palpate these muscles. This just feels like a rock. This is tight. That's not normal for you, right? It can't be. So a lot of times these things happen if you get some misalignment in the cervical vertebra, a facet lock, or some pressure on the nerves, and it just tightens up. As a chiropractor, what I'm going to try to do is just manually loosen this stuff up for her and try to get better range of motion. That may not say 100% you're going to feel 100% no pain letter, but maybe we can get you to move a little better.
Yep.
Okay? So some of this might be just a little hard for you, but we'll just do our best to get you through it.
All right.
All right? So the first thing we're going to do, Erica, I'm going to put some pressure on that big muscle knot, okay? And I want you to look down to your chest and up for me, just as best you can, then come back up. So that's 1, again, 2, and if you need to go a little faster, that's okay, so you go through the pain. 3, 4, 5. What I'm doing is I'm putting pressure on this trigger point here, which is really big, and we're trying to put her through a range of motion to get that trigger point to unlock. So now when you turn your head to the left, and then go up and down for me 5 times. 1, this will be the easier of the two. 2, 3, 4, 5. Okay, now this will be the hard side, so just look as far as you can over here, even if it's only a little bit, and then go up and down for me. 1, try to pull your hair. 2, 3, 4, 5. Okay, you okay? So now we're going to go to the easy side. I just want you to rotate and then come back to the center. Okay, I'm going to put pressure on you. Go ahead. 1, this will be the easier side. 2, 3, 4, 5. Good. Okay, other side. 1, 2, 3, 4. Just a little better. Again, we'll go to the easy side. We'll just bend your head, okay? Go ahead. 1, 2, 3, 4, 5. You okay with that pain? I know it hurts a little bit.
Yeah, it
Now,
is.
let's try the bad side. 1, 2, 3, 4, 5. Okay. Now let's go in your. Let's take those glasses off and then we'll go in your stomach. So we'll go face down. So a lot of you may get this, people wake up with it a lot of times and they just have a stiff neck and they kind of they got to move their whole body to move. I don't think it's part of a degenerative process or big new condition. I think a lot of people just get it from maybe just sleeping the wrong way or under a little stress or something. I don't think Erica has a new condition. I just think that it spasmed on her last night. So this will be, again, a little tender, okay? So we're going to do some more trigger point therapy on her. So I'm going to put some pressure here. Can you lift your head and look this way for me? And then back to the center. Okay, and I know this is pain, so then we'll lift your head up again and go back to the center. So this is, we're going to just kind of do this. Okay, and it's going to be tender. Let me know if I'm too hard on you, okay? So look that way. 1. We'll do it 5 times. 2, 3, 4, 5. Good. You okay with that? This is the easy side, right?
Yeah.
And we're going to put a little pressure here, okay? Again. 5 times. 1, 2, 3, 4, 5. Okay. Okay, and again. 1, 2, 3, 4, 5. Good. All right. You ready for the bad side?
Ooh.
We'll just do the best you can, okay? Just the best you can. Can you look this way at all? 1, good, just best you can. 2, 3, 4, 5. So Erica is one of our patients that we're helping her manage her chronic neck and low back pain. She also sees one of the medical doctors that we referred her to that I think in conjunction with her chiropractic care, some appropriate medication, which works well for her, is helping her manage this pain. Okay, again, this will hurt. So you got a lot of spasms on that side, Erica, don't you? 1, 2, 3, 4. That one gets you hard, doesn't it? 5. Okay, one last one. Try to relax that arm for me. One last one, and the bad stuff's over. 1, 2, 3, 4, 5. Good. All right, let's go on your back for me, face up. Okay, in the past, have we adjusted your neck? I forget. Do it. And I'm not doing anything just yet. I'm just on it. Do we adjust your neck, Erica?
Mm-hmm.
Okay. First, we're just going to stretch it. Okay, so now we're going to go through some more stretching. And just let me know if I'm too hard on you, okay? So these stretches that I'm doing now are very much like the stretches we do when we do manipulation under anesthesia for patients with chronic neck and back problems. You okay with that so far? Yeah. And what I'm trying to do is stretch those muscles out. Okay. Well, this is the bad muscle. Well, actually, no, the other one was bad muscle. You okay?
Yeah.
It won't come off, so I think we're good. Okay so far?
Yeah.
I'm hard on you. Just stretching. That hurts a little bit?
Yeah.
Okay. So next we're going to do a spinal manipulation just to try to decompress the joint for her. Does that hurt that way? Is that the bad side?
Mm-hmm.
How about that way?
Yeah.
Better this side?
Mm-hmm.
Just nice one. I'm just going to bring her head over. Just nice and light. Good. Okay. Yeah, that popping you hear, like Joy's laughing right now, who's filming this, is just decompression of the joint. Okay, did that hurt at all?
No.
Even with your neck being painful when you came in, it still didn't hurt, right?
It didn't hurt.
Okay. This side, well, this side's a little tight. Just relax. Just relax. Easy peasy. Still with me? That wasn't too bad, right? Come on up. We're going to go back on your stomach for me, please. So back on your stomach. Okay, the next thing I'm going to do is use a couple instruments on her, and I want to loosen up her upper thoracics, because really your neck comes all the way down to here, and obviously connected to your thoracics. And all that tightness and tautness and dysfunctional joints can contribute to what she's experiencing today. You okay? Is that tender, Erica?
Yeah.
Drop your hands to the floor. Deep breath. And out. Really gentle. Come up for me. Let's do it this way. So that one didn't move as much as I would like it. Okay, chin down to your chest. Good. There it goes. Okay. Got worked over, didn't you? Sit up nice and straight for me. Okay. Straight. Look over that shoulder. Can I look over the other shoulder? So come on over here this way. So when we first did, we're going to look at it again. So look over that shoulder. Okay, now we're going to look over the other one. So we had better range of motion. Now look, that doesn't mean that it still doesn't hurt, because you injured the nerves or the muscles or something. It's going to take some time to feel better. But if we can get the range of motion a little better, how about
It
this
feels
side?
a little bit better.
A little better, right? Still going to be tender.
Yeah.
So, you know, we may have to get her to talk to her medical doctor also and make sure that she gets the right medication that will help that. My goal as a chiropractor, though, is to increase that function, get it to move better, and then it'll feel better coming along. Okay? All right, guys. Thanks for watching.